This video is for educational purposes only and does not replace official training, local protocols, or medical advice. Always follow your specific agency guidelines and medical control. When a person can't breathe on their own, paramedics use a machine called a mechanical ventilator, or vent for short, to do the breathing for them. It's basically a super smart, computerized pump that pushes air and oxygen directly into the lungs through a tube. Because everyone's lungs are a different size, and because different medical emergencies require different kinds of help, paramedics have to program the vent using 4 main settings. Think of it like setting up a video game or configuring a smart device, but for breathing. Let's talk about settings. 1. Respiratory rate. What it means: this is simply how many breaths the machine gives the patient every minute. How it works: a normal, resting person breathes about 12 to 20 times a minute. Paramedics usually set the machine right around there, often 10 to 12 breaths per minute for an adult, so the body gets a steady, predictable rhythm. 2. Tidal volume. What it means: this is how much air is pushed into the lungs with each single breath. How it works: paramedics don't just guess this. They actually measure the patient's height to figure out how big their lungs should be. If you pump too much air into a lung, it can pop like an overinflated balloon. If you don't pump enough, they won't get enough fresh air. It's measured in milliliters, usually about a soda can worth of air per breath, or 6 to 8 milliliters per kilogram of ideal body weight. Paramedics don't use actual body weight because the lungs do not grow larger as people gain weight. Thus, it is important to know how to calculate ideal body weight. The formula: for males, ideal body weight in kilograms equals 50 plus 2.3 times, height in inches minus 60. Female, ideal body weight in kilograms equals 45.5 plus 2.3 times, height in inches minus 60. Example: 5'2" female. For this patient, we take 62 inches, subtract 60, and multiply by 2.3, then add 45.5, and get 50.1. Now that we have ideal body weight, we can calculate total volume. Let's say we choose 6 milliliters per kilogram. We're going to set the ventilator tidal volume to deliver 300 milliliters per breath. 3. Oxygen concentration, FiO2. What it means: this is how pure the oxygen is in the air the machine delivers. How it works: the normal air you and I are breathing right now is only 21% oxygen, the rest is mostly nitrogen. But a very sick patient might need a lot more help. The paramedic can turn this dial anywhere from 21% all the way up to 100% pure oxygen, depending on how much help the patient's blood needs to stay loaded with oxygen. 4. PEEP, positive end expiratory pressure. What it means: this is a tiny bit of leftover pressure kept inside the lungs at the very end of a breath. How it works: imagine blowing up a balloon. The hardest part is the very first blow when it's completely flat, right? Once it's got a little air in it, keeping it inflated is easy. PEEP keeps a tiny bit of air pressure in the lungs at the end of the breath, so the tiny air sacs, called alveoli, don't completely collapse. This keeps the lungs popped open and ready for the next breath. Typically, paramedics set PEEP at 5 centimeters of H2O and titrate to effect if needed for stiff or wet lungs. The big picture: the paramedic's goal is to balance these 4 settings perfectly so the machine matches exactly what the patient's body needs while they are rushing down the road to the hospital.